Well, welcome to another episode of the Live Today Show. I'm Dr. Cherie, your host and founder of the Live Today Foundation, where our mission is to provide joy, inspiration, and free compression garments to cancer patients and survivors living with lymphedema. Now, guys, I am so excited to continue to share with you, hopefully, what you will find to be helpful tips for how to live with lymphedema. I want to go ahead and start sharing my screen with you. Since we are still not quite fully yet in the studio, we have to go this route, which is fine. Now I want to share with you guys some living with lymphedema. Now, for those of you who may not be familiar with the Live Today Foundation, you want to know more, you want to find a little bit more detail than what I am providing here in the show, go out to our website at www.live-today.org. We have tons of information out there. As a matter of fact, on today's show, we're going to take a look at the website so you can see just what all you're able to find out on that website. If you have someone, maybe you, someone you know, who's under-resourced, underinsured, uninsured, facing financial difficulties, who is living with lymphedema and are unable to afford their compression garments, they've been wearing the same compression garments forever, they're not fitting properly, and they're in need of some new compression garments, shoot us an email at info@live-today.org or give us a call at 754-220-0234. Now, if you're out on social media, I hope that you are following us, you're checking us out, you're looking at what we're placing out there on social media to help you along your lymphedema journey. Please follow us on Facebook, Instagram, and Twitter at livetoday.org. That's livetoday.org. And please go out to use to subscribe to our channel so that you can be made aware of all of the new shows that we place out there. Look for us, just look us up at the Live Today Foundation. Now, today I want to continue talking about how to live with lymphedema. So lymphedema, treatments and therapy. Your physicians may send you to a lymphedema specialist. If swelling has been detected, they should. If your physician has detected swelling and does not make a physical therapy referral, you need to request one. Swelling in an extremity after cancer, during cancer treatment, after cancer treatment is not just some swelling. It needs to be treated and addressed. So if your physician does not automatically refer you to a physical therapist, you ask to be referred to a physical therapist. These trained specialists can get you started on the best ways to keep your swelling under control. Now, some of the most common treatments include compression garments. That would be these. Compression sleeves and stockings for the arms and legs relieve swelling. Compression pushes this fluid back into the circulation by increasing the rate that the lymphatic fluid is filtered out of the soft tissue. Compression also gives you external containment, which prevents and helps control swelling. Other compression garments are designed for different parts of the body where swelling occurs. These can be fit to your needs. Sometimes there is multi-layer compression bandaging. That's what I went through when I was first diagnosed with my lymphedema. I wasn't immediately placed in a compression garment, but rather I went through multi-layer compression bandaging prior to me finally being fitted for my garment. So I went through that compression bandaging to try to get down and get out as much swelling as possible to see what my baseline was going to be so that I could be fitted into a garment that was more appropriate after pushing out as much of that excessive swelling as possible. So a short stretch bandage helps reduce swelling to soft tissue. They are usually applied with levels of pressure to help reroute that fluid from the swollen areas back into the lymphatic system. Once the lymph fluid is moved out of a swollen limb, it's a good time to wear your compression garments to prevent swelling from returning. Then there are also those compressive or compression devices, that pneumatic compressive device that I mentioned in the previous show. It's a pump that connects to a sleeve, which is wrapped around the arm, your leg, chest, could be genitals if there was pelvic cancers, or head and neck if there were head and neck cancers. The sleeve is inflated and deflated in a cycle. This on and off pressure gets fluid moving through the lymph systems and the veins, and it keeps it from building up in the arm and leg. Compression pumps have been shown to reduce the risk of infection, but again, by the time you're using compression devices, multi-layer compression bandages, and compression garments on a regular daily basis, you now have chronic lymphedema that you will have to manage for the rest of your life. And I'm talking to both those individuals who have already been diagnosed, but I'm also appealing to the individuals who are newly diagnosed, who are watching this for the sake of their loved ones who have not noticed any swelling for that individual. I'm also going to continue to provide you with information of ways that you can participate in your clinical care path such that you do not end up with chronic lymphedema. So, manual lymphatic drainage. Remember when I told you when I was first diagnosed, I went through that multi-layer bandaging. But with that multi-layer bandaging, my physical therapist, who was properly trained in how to appropriately treat lymphedema patients, took me through what's called manual lymphatic drainage. Now, that's a very light form of massage. It involves gentle skin stretching on the soft tissues, and is completed again by a certified therapist. Lymph from these swollen areas is gently transferred into an area where working lymph nodes exist. And I was taught, and patients are taught on how to perform manual lymphatic drainage on themselves. So you do the manual lymphatic drainage in the morning, which is what I do. And then that helps relieve any swelling that may exist. And then I put on my garments. Now that keeps the swelling from returning. Likewise, when you initially start off with a physical therapist, you may go in, start with the manual lymphatic drainage. Then the therapist may put you in multi-layer bandaging for a while, for several weeks possibly, depending upon how bad your lymphedema is. I was treated daily for physical therapy for 16 weeks before I finally got to where my baseline was, where I could be actively and appropriately measured for the appropriate compression garments for me to wear on a daily basis. So keep in mind, it's not a simple fix. It's not a couple weeks thing. You may be in physical therapy for a little while, getting down to your baseline. You can also participate in exercise, and your physical therapist should recommend this as part of your home exercise program. So physical exercise as well as the decongestive exercise, they're important in order to stimulate lymphatic drainage. The muscle pump contraction filters out lymphatic fluid. So when you're doing, certain movements, not with heavy weights, we're not talking about that. We're just talking about no weights at all, but just taking your body through appropriate certain ranges of motion. That contraction of your muscles, that muscle pumping kind of filters out that lymphatic fluid. And the decongestive exercises like your manual lymphatic drainage help stimulate the lymphatic system to take up the fluid and reduce the swelling in the affected limb. You may also undergo complete decongestive therapy. CDT combines compression, manual lymphatic drainage, meticulous skin care, and exercise. That was me. Depending on the severity, this type of lymphedema treatment can last from 2 weeks to several months. Again, mine, 16 weeks, so 4 months that I went through complete decongestive therapy before finally being fitted for my daily compression garments. There are now surgical treatments for lymphedema. Surgery is considered if other non-surgical treatments aren't working. Not everyone is a candidate for surgery. I was not. I was evaluated by 2 different surgeons, and I was determined not to be a candidate for surgery. But for some people, symptoms can be eased with the surgical procedure. So there is a lymphatic bypass procedure where the lymphatic vessels and veins are connected and rerouted around obstruction so that the lymph fluid can drain directly into the body's venous system. Advances in surgical techniques are now reducing risk and creating less invasive procedures. You can also may be a candidate for lymph node transfer. Lymph nodes from other parts of the body are placed into areas where there has been impairment to the lymphatic system. This procedure helps restore a healthy lymphatic system to that region. Now, the problem with the lymph node transfer is that when you remove lymph nodes, let's say, and this was discussed for me as an option, because I have lymphedema that affects my right arm, hand, and fingers, there was consideration of a lymph node transfer from my left groin area and to place those working lymph nodes into my right axilla. Well, there is a risk that one, that lymph node transfer either won't take or to take somewhat, and maybe I'll see a little relief, but not a whole lot. But removing the lymph nodes from my left groin area now sets me up for risk for lymphedema in my left leg. And so now it was explained where you could end up with not so much improvement in your right arm and now acquire lymphedema in your left leg. And so even though I wasn't a candidate for surgery anyway, just the thought that even if I was a candidate, that one just didn't sound as appealing for me. But it's out there. To each his own. You have to make the choice of what's best for you. Then there's a thing called liposuction. That's a treatment where fat and other tissues are removed through a small incision in your body. The effects of that, benefits of that, again, you'd have to talk with surgeons that are doing it or clinicians that are doing it and really find out, well, what benefit have patients received with that form of treatment. And then there is a thing called debulking, and it involves removing all of the skin, fat, tissues of the affected area, and then placing a skin graft over this region. That's only used in very advanced severe cases. I mean, you are at lymphangitis at that point where it looks like elephantitis. Your legs and your extremities are like 5 to 6 times their size and oozing lymphatic fluid. So that is for the rare extreme cases. So you may wonder, are compression garments and pumps used for lymphedema covered by Medicare? I mean, you're doing all of this talk. Well, generally, compression sleeves and stockings for lymphedema aren't covered by Medicare. Hence, the reason for the Live Today Foundation. I, as a physician, did know, although I diagnosed patients with breast cancer, I wasn't the treating doc, so I referred them to the appropriate people. So I didn't necessarily know or appreciate the steps that a cancer patient goes through, a breast cancer patient in particularly goes through. Certainly didn't know what to expect or even to express to a newly diagnosed breast cancer patient anything about lymphedema. And so you can imagine, to my surprise, when I'm now diagnosed with lymphedema and I'm, finding out about compression garments, and I need to get these compression garments, and my compression garments initially were custom made. Custom made garments ran about $2,500. And to find out that not only did Medicare not cover them, but a majority of private insurances don't cover them. Now, there are some wonderful organizations out there that fit you for your garments, and they will strive and work. They have the proper coding, and they are able to get compression garments approved. Sometimes maybe not 2 of them a year, maybe 1 of them a year, but you really got to go with an organization, a fitter that knows the ins and outs of the insurance world and know how to code properly and make the request appropriately to get past those loopholes. But the thought and the idea that a patient could be diagnosed with cancer, get treated, and we know that the treatment can lead to and cause another disease that is incurable, that is lymphedema, and Medicare not to cover the forms of treatment, that the standard forms of treatment that patients would need with this condition, still blows my mind. Medicare won't cover it, Medicaid won't cover it, and like I stated, many private insurers will not cover the compression garments, and many of them sometimes won't even cover the pneumatic pumps. Drives me nuts, but that's why organizations such as mine exist, so that we can get you the help that you need. A home compression pump will be covered if compression garments aren't working well, but then you got to be able to afford the compression garments first to even trial that, but the compression garments are not covered either. So if you can't afford the compression garments, and we know the compression garments wouldn't help you, you most certainly won't be able to get the pump, because you can't get the pump unless you prove that the compression garments don't work. It's a mess. If you have secondary insurance to Medicare, they may cover compression garments and pumps as well. But again, you got to work with the clinician, the physical therapist, and or the fitter that knows the proper coding and knows how to word that request such that they can work through those loopholes to get you the coverage that you need. So talk to your clinician about all of your payment options with your lymphedema therapy. Again, if you want to know more information about the Live Today Foundation, go out to our website. And as a matter of fact, I want to take you out to our site right now. And in particular, I want you to see this. For those individuals who are newly diagnosed, again, you're newly diagnosed with cancer, breast cancer, prostate cancer, cancer that can affect and cause lymphedema in any of your extremities, your arms, your legs. You need to be asking your clinician, your physician, your cancer surgeon, is there a lymphedema prevention program at this institution? What is it that you do? And what you are particularly looking for is a lymphedema prevention program that has one of these. It's called a SOZO device. You see this scale? It is absolutely phenomenal because it's a non-invasive test that you step on, 30 seconds. It measures your total body fluid, your intracellular and extracellular fluid, and it's a simple protocol. You test, then there is a trigger, and then you treat. Your trigger is the difference between what your baseline score was, preferably before you have surgery. So before anything is done, we want to see what your baseline is. If not, it's still not too late. So if you've already had surgery, you don't see any swelling in your hands, and you've even had some radiation or chemotherapy, I don't care. If you don't see any visible swelling, get on the phone right now, call your doctor's office and say, hey, listen, somewhere in my treatment, we never talked about a lymphedema prevention program. I don't see any signs of lymphedema, but do you have something that I can be a part of a protocol that will follow me as necessary so that we can determine if and when I ever develop those reversible stages of lymphedema so that I can get treated and never have to live with chronic lymphedema for the rest of my life. And so when that trigger occurs, then we treat you. And treatment can typically include 4 weeks wearing compression garments for 12 hours a day. That's it. Test, trigger, treat. So you can go out to our website, go out to the lymphedema prevention program, do a little reading on the SOZO device. If you want to find out where you can go for a lymphedema prevention program, you can click here. These are some additional videos for you to watch, patient videos, prevention videos that will help you to understand what this device is and how crucial it is to be a part of a lymphedema prevention program. We also have this patient education resource page. Look at all of the invaluable information you can review. One, gives you the instructions on what is my lymphatic system, what causes lymphedema, what are the signs and symptoms, what are the stages, how is it diagnosed, what is it about lymphedema prevention, how do I reduce my risk, lymphedema treatment, lymphedema management, and then there are some additional brochures that you can review, download. And for other institutions, if you are watching, there are brochures that you are welcome to download and print and provide to your constituency that will help them on lymphedema and help them to understand that what if I'm a breast cancer patient and I decide to undergo breast reconstruction immediately and or later on down the line after my breast cancer treatment? What are my risks for lymphedema? Should I get breast reconstruction? The brochure that you see on our site can provide you with some invaluable information as well. So we have a lot of information out on our website, and I want you to feel free to go out to our website and get the information that you need. So again, if you are looking for more information, go out to our website at www.live-today.org. Shoot us an email. You know someone who is in need of a compression garment or who just wants some additional information or clarity when something that was expressed or shared in the show. Shoot us an email at info@live-today.org, and or you can always give us a call at 754-220-0234. Again, if you are out there on social media, give us a follow on Facebook, Instagram, and Twitter at livetoday.org. That's live today, DOTORG. Follow us on YouTube, subscribe to us on YouTube, so you can keep up with all of the new shows and invaluable information that we place out there in video format. There are going to be webinars, there's going to be some training, there's going to be some exciting new stuff that is coming up that you'll only probably be able to find on YouTube. So you're going to want to subscribe to us. Just search the Live Today Foundation. You guys have been absolutely wonderful. I hope the information that I have shared has been helpful to you as a lymphedema patient and or a caregiver for someone who's living with lymphedema. But I cannot stress enough that if you are a newly diagnosed cancer patient, let's say you're not so newly diagnosed cancer patient, but you have never experienced any signs or symptoms to your knowledge of lymphedema. You say, I don't feel like my hand or my legs are tight. I don't feel like they're swollen. I don't feel any pain. I don't feel anything. I don't think I'm going to get this lymphedema. Don't become complacent thinking that it's never going to show up. Get on the phone. You should still be, as a cancer patient, cancer survivor, there should be some form of follow-up with some physician. It's either your cancer surgeon, it's your medical oncologist, it's your radiation oncologist, somebody you're seeing for follow-up on a regular basis. You need to get on the phone, call their office, and ask them, hey, whoops, forgot. I don't think we've ever talked about lymphedema prevention or my lymphedema risk. Do you have a lymphedema prevention program? If so, I would like to become a part, and please describe your protocol. Oh, and by the way, do you have a SOZO device? You have to ask those questions, because trust you me, you don't want to end up like me, where you are in a career, you are loving your career, you are set, life is going good. And then not only do you get diagnosed with cancer, throw you for a loop, flip your life upside down. But then when you're done treating for your cancer, thinking, for now I've dodged that bullet, just to a year later get diagnosed with chronic lymphedema, a disease that I will have for the rest of my life, except God wrought a miracle. I will be living with this for the rest of my life. And for my line of work, it disabled me from my clinical practice. Don't let this happen to you. It doesn't have to. You simply just have to ask the question if it hasn't already been volunteered. And once you ask the question, and once they give you the information that a lymphedema prevention program is available, then you need to take control of your own health. And by golly, be a part of that prevention program, and keep your follow-up appointments and get tested religiously. Trust you me, it is worth it to not have to live with buying garments for the rest of your life, changing your wardrobe, changing your career, changing your social, not your status, but changing what you do socially, changing whether or not you like to participate in outdoor sports, you like to play softball, baseball, basketball, all of that impacted by lymphedema. Why would you subject yourself to that when you don't have to? I had no choice. The ability to detect reversible lymphedema, it wasn't available to me when I was diagnosed, but now it is. And armed with this knowledge, we should have very few people ever being diagnosed with chronic disabling lymphedema in this day and age, when LDEX scores and SOZO testing is available for every cancer patient out there if you do the research and find the right location. And I'm appealing to all healthcare systems, physicians, in private practice, employed physicians. If you're under the sound of my voice and you know about bioimpedance spectroscopy and you know about a SOZO device, you need to work with your institution and do what's right for your patients, and be a part and develop a lymphedema prevention program, and help me help them not only be able to have a wonderful quality of life and a beautiful survivorship, but to be able to carry on a legacy for generations to come beyond their cancer diagnosis and beyond what cancer did to them. Help make them whole again. I hope you have enjoyed the show. I hope the information that has been shared has been helpful. We're going to continue this discussion actually because there's more information I want to share about living with lymphedema. It transforms your life. But I'm Dr. Cherie. You've been watching another episode of the Live Today show. And remember, I want you to be present. Take charge of your life. And remember to live today and every day. God bless you guys. Until the next time, be good.